Good afternoon, everybody. Here with Paul and Josh and Angela Wong. Angela is at Pfizer, a leading expert on vaccines, can give us the update on incredible news regarding vaccines that comes out every week now. So let me just go quickly through our COVID daily summary. I think what you can see here is a couple of things. One, we continue to do a lot of testing, a lot more than our peers. That'll be relevant in a second. The positivity rate, 4.45%. It's been about 3.7 over the last 7 days, relatively steady. Current hospitalizations down 21. That's good news. Fatalities up 14, but still averaging about 5 a day over the last week or two. So obviously, we're going to talk about fatalities here in a second and what that says about our vaccination program. This chart is not necessarily a chart you want to be on, but these are 10 states during the last week. In terms of cases per capita, this is the number of cases, COVID-related positivity that you have. You can see on the left-hand side that it's really related to Michigan and the Northeast. And you can see we're right in the center there, next to New York, Pennsylvania, New Jersey. A little bit interesting. You say, okay, there's probably a geographic footprint to this, probably a little bit of seasonality. As I look at the chart, it's a little unnerving to see the positivity kind of going up Metro North again, a little similar to where we were exactly a year ago. It's also worth noting that in those groups, those states in the Northeast that have the highest positivity, top 10 in the country, some of them are at 50% capacity, some of them are at 100% capacity, some have a curfew, others don't, some close bars, some open. So it gives you an idea that there are some bigger factors at work. The other chart is fatalities, deaths per capita. And it's sort of interesting to see how that's not necessarily directly related to cases per capita. And I think that's because of different vaccination strategies in part. So, for example, you can see that while Connecticut is in the top 10 in terms of cases per capita, as I always like to add, we do about 10 times more testing than the South. So, but still, we have a high positivity, but we're one of the lowest in the country, number 35 to be exact, when it comes to fatalities per capita. So it's just a reminder, I think, that vaccinating folks who are most at risk, vaccinating those who are most likely to suffer complications or death made a big difference in terms of where we are in that chart. So I think that was worth remembering. It's worth showing that vaccinations work. The vaccine update, this is what's interesting. First of all, everybody is now available, 16 and over. And we made 100,000 appointments today. I know that many of you are there at 12:01 in the morning hitting that refresh button. Be a little bit patient, but right now the vaccine flow is still continuing. I know you heard about a hiccup at Johnson & Johnson. That's not impacting Connecticut. We didn't have any supply from them. We got our supply for this week. We have our supply for next week. 81% of those 65 and above have now had their doses. That's number 3 in the nation. That makes a big difference. And 43% overall have had at least their first dose. 43% of 16 and above. So we're making very good progress on that front, and I think it's being reflected in hospitalizations and fatalities. Look, let me just, as a lead into introducing you to Angela, just a little bit of good news that I can steal her thunder. Sorry about that. Number one, it's worth noting that Pfizer and their partner BioNTech have done some preliminary testing and found that the vaccines are working for a younger demographic. Right now, only Pfizer has been approved for 16 to 18-year-olds, and we're going to be targeting Pfizer for the high school, college population. And now preliminary testing is showing it's safe for 12 to 15. That's really important as we broaden the reach of our vaccines and make sure more people are immune. And secondly, it's highly effective for at least 6 months. We may be taking booster shots and the such going forward in the future, but I think this is good news that it's working. and that it's working on a wider variety of contexts. Angela, what does this mean to us?
Well, thank you, Governor Lamont, and I'm really honored to be joining you today and having this opportunity to talk to all of you about our vaccine. But before I begin, as you know, I am a longtime resident of Connecticut, and my husband and I have raised both our kids here, and our family has created strong roots in this community. So first of all, I want to thank you and commend you for your leadership in managing this pandemic. And just from the outset, you provided the structure, clear direction, resources, and care. And whether it was about testing or guidance on social distancing, and now just the charts that you've reviewed, the vaccine distribution, it's been really tremendous. And so from the bottom of my heart and as a Connecticut resident, thank you. But for us here at Pfizer, we're proud to have a very strong and well-established footprint in Connecticut. And we celebrate the role that Connecticut Bioscience has played in actually helping us to develop and distribute this vaccine. In fact, our Groton R&D site is the largest in our research and development network. And more recently, it played a really pivotal role in the manufacture of the COVID-19 vaccine through its work in manufacturing lipids. These lipids, which are used to make the vaccine, were made in Groton, and the lipids that were made in Groton have contributed to over 100 million doses of the vaccine. And even though today we have a safe and effective vaccine, we know that there's so much more work to do to explore the full potential of this therapy. And this is where science and R&D continues to lead us. We're looking at expanding age groups, as well as understanding the duration of protection for the vaccine, as well as building a comprehensive set of knowledge and tools to help bring this pandemic to an end. And as you just saw this very week, with our partner BioNTech, we shared two exciting pieces of new data. On Monday, we shared results from a study of adolescents ages 12 to 15, where we saw a 100% vaccine efficacy. This is really exciting and a potential step towards vaccinating this age group and hopefully getting our kids back to school in the fall. And then this morning, we announced updated top-line data from our landmark COVID-19 vaccine study that demonstrated vaccine effectiveness against the COVID-19 at 91.3%, 7 days through to 6 months after the second dose. And if you look at the CDC's definition of preventing severe disease, the vaccine was found to be 100% effective. And if you look at the FDA's definition, the vaccine was found to be 95.3% effective. And we've also heard a lot about the emergence of variants. And we're happy to share that our vaccine was found to be 100% effective in preventing COVID-19 cases in the South African variant. So this is all very promising. And for us at Pfizer, we believe that science will win and that we will continue to gather more evidence on the safety and efficacy of the vaccine for all important populations. So my hope is that this year we'll put a lot of this behind us. While we won't be in a crisis forever, it is also clear that rigorous surveillance and continued responsible public health measures, as well as getting vaccinated, remains critical. So Governor Lamont, you can count on Pfizer to continue to work closely with you and governments around the world to ensure the continued delivery of our vaccine. And rest assured that we will leave no stone unturned in the fight against COVID-19 today, as well as in the future.
We're lucky to have you here, Angela, and Pfizer. Thank you for that. Let me ask you the first question then. You're working against the Brazilian, you work against the UK. There's going to be a myriad of other variants as years go on. Does the mRNA methodology give you a little more flexibility to respond to these variants as they come along?
It absolutely does. The beauty of the mRNA technology is that once you have the genetic sequence of the virus, you can quickly make it and in a very short order be able to produce a new vaccine. And so we feel very confident that this technology platform that we have developed gives us options, right? The first option is that, as you've seen today in the data, we could just vaccinate and boost with the same vaccine that we have today, keep a very high level of immunogenicity in our bodies, and that is the mechanism by which we could manage the new variants. or if needed, we could make a vaccine, another vaccine. And we've actually estimated that we'll be able to make a new vaccine in about 116 days, subject to obviously regulatory approval. So whichever way this goes, I think we can be rest assured that we have options and we have solutions that will enable us to really meet the needs and be able to respond to however this virus emerges and changes through time.
Well, thank you. Angela's got to go innovate in about 10 or 15 minutes, 10 minutes, but we got a time for a few questions as needed.
Yes, Angela Wong will have to leave at approximately 4:30, so putting that out there for our reporters. Channel 3 Eyewitness News.
Yes, a question for Ms. Wong. We know that the vaccine efficacy is around 6 months. So, what's the process going forward to determine how often we may need to get this shot?
Mm-hmm. Well, first of all, we are doing a study to understand, the effects of boosting. And when you boost, whether it's from 6 months to 12 months, what that looks like. So I think, what we know today is that we have a highly effective vaccine that is safe, that the duration of protection, as we know it, is to 6 months today. And I think that this next study will help us to understand, what are the time intervals by which you need to boost, at 6 months or at 12 months. But I think the important thing to remember is that with the variants that we have seen that are really quite prevalent in the world now, the need to boost is in our reality. And so it'll just be a matter of figuring out at which time intervals that is.
Got it. Thank you. And Governor, a real quick question for you. The chart that you just showed shows that the state expects supply to exceed demand by late April. So is there going to be a point where you say, all right, we've given people enough time to have the opportunity to get vaccinated and we're going to reopen the state fully? I mean, maybe the mask mandate will still be in place, but no social distancing to the point where businesses can have what was full capacity again.
Not for a while. You're right. We're going to have very good capacity in our vaccines in a month, 6 weeks. I'd like to see the demand pick up. I'd like to get us close to herd immunity. With thanks to Pfizer, we'll probably be able to start vaccinating younger people over a period of time. But that doesn't mean there still won't be variants and risks out there. So I'd probably err on the side of caution a little bit longer than that, Matt.
Thank you.
Fox 61.
Hi, my first question would be for Angela. Could you talk a little bit about this study done on the individuals between the ages of 12 to 15? Was it used the same exact vaccine that is given to individuals that are 16 and older?
Yes. So we ran the clinical trials were conducted in the same way that they were conducted for all the other age groups. We had a placebo group, and then we had a test group, and the test group received the exact same vaccine at the exact same schedule. So at day 0 and at day 21.
And then my next question is for the governor. You mentioned that the Johnson & Johnson incident with the manufacturing issues, it will not have an effect on Connecticut's supply, that you received the shipments promised. But what would have happened if something like this did affect the state's COVID vaccine supply coming from Johnson & Johnson?
Well, I'll start, but probably Angela should answer that question better than I. The good news is none of our J&J supply came from that particular facility. The good news is we got our dose for this week. We've got our dose for next week, all on track. I think we would have detected things, but Angela or Josh, do you have some insights on how we would have detected that?
I mean, just speaking from a Pfizer perspective, I don't have any insights into, what happened in this particular incident with the J&J vaccine. But maybe what I can do is to provide some assurance from my end, which is that, from the time we started making this vaccine, what we've seen is tremendous improvements improvements from a process perspective, improvements from a capacity perspective, improvements from a lipid production perspective, which is a critical ingredient to making this vaccine, which is why Groton was so critical, in this journey of ours. But we've raised our production numbers at least 2 or 3 times already. We started at 1.3 billion, then we went up to 2 billion, and our latest estimate for the world now is 2.5 billion. So, we are feeling very confident about the infrastructure and the process that we have developed for manufacturing this dose, and we will be able to step up to whatever doses are required, if that's what is needed.
Yeah, and I would only add, I think the Johnson & Johnson example is actually should give people a lot of confidence in the fact that the processes in place in the United States for quality assurance and quality control around pharmaceuticals and vaccine manufacturing and production are the best in the world. And so there are multiple checks in the process designed to catch defects in the manufacturing process. My prior life, our software company served biopharmaceutical companies, including Pfizer, and so we know very well how rigorous the standards are, and I think this is just an example of those standards working perfectly well. And as the governor said, fortunately for us, we'll still get our J&J doses from a different manufacturing facility for next week. Beyond that, we have a little less clarity in terms of how this plays through, but at least for the short term, when we have far more demand than supply still, particularly as we open up to the rest of the state today, we'll be well positioned to keep vaccinating very quickly this week and next week at least.
Thank you.
NBC Connecticut.
Good afternoon, Governor. Matt Austin with NBC Connecticut. My first question was just to Angela, just in terms of opening up the Pfizer vaccine to this younger demographic. Do you have any expectation of how soon it could be authorized for that use?
Thanks for the question, Matt. So per all of our the standard procedures that we would have, we are now taking this data and we will be submitting it to the FDA. The FDA will then take the opportunity to review the data. They will consult with the CDC, and much like what you saw in December, the CDC and the FDA will provide the CDC provides their recommendation, the FDA then applies the approval, and so we hope that over the next the next several weeks or so, we'll be able to see some of this come to pass, and that will then lead us to the authorization. So that's those are the anticipated steps right now.
Gotcha. And I just know, for a lot of parents, the decision whether to vaccinate their kids or not can be, very difficult and emotional. What would you want them to know about the vaccine and when they consider, vaccinating their own child?
No, that's a great question, because I think that there are just so many questions out there right now around just knowledge of the vaccine and vaccine confidence. And what I can share is that this is a vaccine that has been tested rigorously. It was tested in 44,000 people, 18 years and older. And more recently with this study, another 4,000 individuals, 12 to 15 years of age. And that's just in a clinical trial. In addition to that, this vaccine has now been administered to close to 90 million people around the world. And so we have real-world data that accompany the clinical trial data that we've seen. And so amongst these 90 million people that we've vaccinated, we have not seen any adverse events that were different from what we saw in the clinical trial. So the consistency of what we've seen from both an efficacy as well as a safety perspective has been repeated over and over again. And so, I think my message to everyone, whether it's the younger, the adolescent, or the older population, the 18 plus, or the more recently, the data that we're seeing on the 12 to 15, is that this vaccine is safe, is effective, and it was deemed to be so not only by the FDA but by all regulatory agencies around the world.
Thank you, Angela. And Governor, just going back to the Johnson & Johnson vaccine, I know you were talking about at least the state supply this week and next week seems secure, but going beyond that, there are some question marks. Can you say how that might potentially impact some of the equity programs, which I believe we're really going to rely on the Johnson & Johnson vaccine?
I believe the Johnson & Johnson is going to, ramp up and be able to get the doses we need. There may be a week delay, something like that. But you're absolutely right, Matt. The single dose is a lot easier to monitor and administer for many communities, especially when we're going in with a mobile van and finding people, some of whom are able to walk up in the very near future. But in the meantime, the Pfizer and Moderna, we're going to be able to work in those same communities with that as well. So I'd like to think we're not going to miss a beat.
Okay, thank you.
News 8.
For both the governor and Josh, understanding that today is just the first day with 16 and over, but is there anything in the early going here that you can tell us about how you would characterize what you've heard from people at some of the sites and what you expected, and how has it been for this demographic?
I'll start. I think a lot of folks in this 16 to 45 were really looking forward to this day and what it meant. Paul was describing what he saw on social media, people taking pictures of themselves, feeling liberated. This is a demographic that's been waiting, a couple of months now for their opportunity, and I think it made them smile.
Yeah, I think on a day like this, the news is the news that we don't make, right? Which is things going generally smoothly. We know there's some people out there who are frustrated who haven't been able to find an appointment yet. As we had warned, every time we open up a new phase, there's a lot more people looking to book appointments than we have vaccines in that week. But with the continued supply over the next couple of weeks, all of our providers are constantly adding new appointment slots. We remain confident that everybody who's looking for a vaccine today, even if they haven't been able to find an appointment, will be able to find one within the next 2 to 3 weeks. So please be patient and hang in there. But we believe over 100,000 people booked appointments today as the new eligibility expanded. So that's a good start, and we'll keep going through the next couple of weeks until everyone has that opportunity.
And Governor, just to switch gears a little bit, something that we've heard about, and I think a couple of sports venues, NBA franchises, have begun with their fans asking for a vaccine, either a passport or something to prove. Where do you stand on the idea of a COVID-19 vaccine passport for Connecticut residents, and especially in terms of possible privacy implications?
Yeah, I think it's a little premature. We just opened to the youngest demographic now. Let's give it 6 weeks. Let's get everybody an opportunity to get vaccinated. But you're right. If you want to go to Madison Square Garden, if you want to go on a JetBlue flight, they say, I want to see proof that you've been tested or vaccinated. And whether you see that moving into our sports venues, you see that moving into restaurants and stores, I think the private sector will probably take the lead there, but let's not get ahead of ourselves.
News 12, Connecticut.
Good afternoon, Governor Lamont. A question for you is, now that the floodgates are open to thousands of people, like you guys said, 100,000 people have made appointments today, is it a concern that people with underlying conditions that are not prioritized are going up against healthy individuals to find appointments?
Well, as you know, the majority of those folks were in the 45 and above age group, so they've all had their opportunity to get vaccinated. We did prioritize a number of conditions. They're in the fast lane, so to speak. We did that in association with our hospital administrators. And so I'd like to say to others who maybe feel like they're more vulnerable, it's now available to you, and I think your doctors, medical community, do everything we can to make sure you get vaccinated on a timely basis. I know for the intellectual disabilities, we're making a special effort there to get thousands of people vaccinated on a priority basis over the course of the next 10 days.
The Associated Press.
Thank you, Max. Good afternoon, everyone. Ms. Wong, you said that rigorous surveillance and public health measures will still be needed. What would you think that would entail? Should we be seeing a mask mandate for years to come, months to come? And also, when will we learn more about when or if we'll need a booster?
Yeah. So our booster trials are actively in motion, And so I would say by the summer, we'll have a much greater sense and a much better sense of what that looks like and the time intervals that I talked about earlier, by which we would need to boost and what that would look like. So I think over the next several months, we'll be able to learn more. I think my comment more broadly around surveillance is that for us as a pharmaceutical company, surveillance is going to be really important, right? Because we need to continue to monitor these variants, the emergence of variants. Are there new variants? How many mutations do they have? How different are they as they continue to change? So that we can stay on top of what our needs are in terms of providing a solution. And then I think good public health measures, especially in this moment in time, is going to be really important. As Governor Lamont said, just here in Connecticut, we have just over 40% of our population vaccinated, which means that 60% of them are not. And until we get to a place where the majority of people are vaccinated so that we can build herd immunity, outbreaks and places of infection can continue to emerge. And so that's why, the surveillance on my part, but just good public health behaviors on all of our parts are going to be important until we get to that place where we achieve herd immunity.
Thank you. And Governor, has any thought been given to increasing the vaccination slots for people that want a drive-through appointment? I've heard from someone with a compromised immune system who was on the vaccine assistance line today for about 4 hours before being dropped off. So is there any thought about maybe setting up a special phone line or a website just for people that really need drive-up appointments because they just can't go inside a pharmacy?
As you know, Sue, we've got the mobile vans. We're taking the vaccines to people wherever we can. I think you're right. I think that we ought to have a special line. We're telephoning out thousands of calls every week now trying to find these people. Through the hospitals, they're making the same outreach to people as well. We're trying to find those who are the most vulnerable. I mean, I'm sort of interested that the Connecticut Children's Hospital, all those kids are going to get vaccinated over the course of the next week. So we are really trying to find those people that need it and make sure they get their vaccine.
Are there any thoughts, though, of maybe increasing the number of drive-through vaccination sites?
I think the mobile van handles some of that. I know that we're having a 24-hour Vax-a-thon next week where people will be able to come in and by appointment and get vaccinated easier. I'll have to think a little more about the drive-through site. Josh, maybe you have some insights there.
Yeah, no, it's a request that we've heard a few times. I mean, I think just as a reminder to people, the largest single vaccination site in the state at the Pratt & Whitney runway is a drive-through site. So if you're searching, that's a good place to look. That a lot of vaccine comes through there. But we've also put a filter on the state website. So if you go on ct.gov/COVID vaccine, you put in your zip code and it shows you the list of vaccine sites that are closest to you. You'll see there's a little check mark you can put on there that where you can filter against sites that are drive-through or not. So that can help you also identify sites if you're just looking for a drive-through location. So hopefully those resources are helpful.
Okay, great. Thank you very much, everyone.
We'd like to thank Angela Wong from Pfizer for joining us. She does have to leave, so once again, we'd like to thank her and Pfizer for her participation today.
Thanks, Angela.
Thanks, Governor Lamont, and thank you for having me here today.
See you soon.
Bye.
We'll move along next to WTIC 1080 News.
Hi. As far as the vans go, when are we going to start to see those 35 vans head out?
I think we're going to see those 35 yellow vans heading out, within a week or so, if I have that about right. There are yellow vans. They each have about 150 doses there, and pretty soon, you'll be able to walk up like it's the ice cream truck and get a vaccination. Right now, it's still by appointment, but we're getting there.
CT News Junkie.
Thanks, Max. Josh or the governor, I asked about this a few weeks back, but I was wondering if there's any plans to when we might have, now that there's everyone's sort of eligible to get a vaccine, when state employees might be asked to come back into the office. I understand that some of the businesses in Hartford are kind of hurting because a lot of those folks who used to be in the area and using those businesses are no longer.
Josh?
Well, we're going to continue to follow the public health guidance, same as what's recommended for all office-based employees. A significant portion of state employees, of course, have been working every day on site in critical frontline essential roles throughout this pandemic. So we don't want to lose track of them. But for the people who are office-based, our expectation of all of our agencies is that they're fully productive right now. And until we have everyone vaccinated and COVID really in the rearview mirror, the governor and Commissioner Gifford continue to urge caution around, pouring back into office buildings until we, make sure we've got it well under control. So we'll continue to follow the same guidance that, are being provided from a public health perspective for, all office-based workers.
So you would say there's no immediate plans for that until we achieve something like the herd immunity that Ms. Wong was just describing?
We're going to keep taking it, kind of week by week, month by month, based on what the public health guidance is. I mean, there's people in our office buildings every day right now, but there's also still a lot of people telecommuting, which until we really have COVID behind us is probably prudent.
Okay. Do you have any updates on the IDD clinics? I guess you guys were going to hold some on Friday.
Yeah, first two tomorrow. Really excited about this. Compliments to Commissioner Sheff and his team, Katie Rock Burns over there, doing an amazing job. So first clinics tomorrow, one in Torrington, one in Trumbull. About 1,000 people signed up to be vaccinated. And another, I believe, 17 clinics over the next 2 weeks were scheduled. Outreach has been done to everyone in the DSS network, all individuals with intellectual and developmental disabilities across the state, about half of whom have already been vaccinated because they may live in a congregate setting where we prioritized vaccinations back in January. But that's well underway and really excited about that.
Okay. Governor, I guess you have proposed the CBI is describing it as a tax on health insurance. They're saying some of those costs may be passed on to consumers.
That's absolutely wrong. There was a federal tax, which 90% of that's going to go away. The last of it we're going to use in order to help subsidize the people in the exchange. As you know, the rescue plan offers extraordinary subsidies for people earning up to $70,000, $75,000, bringing down the monthly cost of health insurance on the exchange dramatically. But it doesn't help those folks who have a high deductible or a copay. That's what we'd like to do with our the fee that we're going to put in place. It's a reduction in the hospital tax they got now, but we're not reducing all of that federal tax. And that's going to allow a lot more people to be able to afford health insurance, not only be able to afford it, but afford to use it. And that's what matters.
Okay. Thanks, everybody.
Hearst, Connecticut Media.
Thanks. Either for the governor or Josh, can you describe in a little bit more detail how we're going to get to supply exceeding demand at the end of the month, what the projections are going to look like in the coming weeks?
I'll start. We work every week with the COVID task force down in Washington, D.C. They give us a pretty good 3-week window in terms of what the supply of vaccine looks like. Obviously, the J&J is ramped up a lot. The Pfizer is ramping up a fair amount. So we had a good window. Obviously, there's a bit of a hiccup when it comes to the J&J. But and at the same time, we can see the number of people we have in the 16 to 45-year-old age group and how that's going to be shrinking. So I think that over the course of the next month, 6 weeks, supply could be exceeding demand. And that means we're going to have to work even harder to make that last 20, 25% of the population know how important it is that they get vaccinated.
Thanks. And then specifically for the people who have the 5 conditions that are eligible for accelerated access, can you talk about the rollout to them? Were any of the appointments today prioritized for them?
Josh?
Absolutely. Yeah, our hospitals have done extensive outreach, both through email and outbound phone calling to the people, in their EHRs with those conditions. I believe some of their physicians have been doing some outreach as well. So that's well underway.
And just lastly, Governor, if we could get a response from you on the revised complaint calling for the feds to overrule your vaccine plan.
Who's that complaint to overrule that?
From the disability rights group who filed the complaint against your vaccine plan.
Yeah. Well, as you know, we're going to go prioritize the IDD community, others who are most at risk. We've opened up our vaccination to all age groups at this point. As Josh has explained, hospitals and ourselves doing extraordinary outreach there. So if probably the complaint's a little past due, I think we're doing everything we can to make sure everybody gets vaccinated with a priority upon those people who are vulnerable.
The Hartford Current.
Hey everybody, this is Emily Brindley from the Current. First thing I wanted to ask about, do we have those SBI targets, the equity targets for this past week?
Yes, so for the past week, as I think we mentioned before, the target actually went up from 25 to 26% when we opened up to 45 and above 2 weeks ago now, I guess it was. Last week, we did 24% of our vaccines to people who lived in those 50 high SBI zip codes. This week, we improved another point, so up to 25% of the vaccines administered last week were to people in those high SBI zip codes. So still not quite at the target, but ticking upwards, and appreciate all the efforts our providers are making to do even more to provide access to people who are living in those under-vaccinated communities.
And what is the new goal now that vaccinations are open to everyone 16 and older?
So as we open to everyone 16 and older, the target will, for next week, go from 26% up to 31%.
Okay, thank you. And then, Governor, I also wanted to ask you about some reopening stuff, because tomorrow, the state is going to see another step of reopening. And obviously, the state's numbers over the past week and a half or so have been a little bit concerning, as some medical experts have said. I know that hospitalizations dropped today, but then positivity went up a bit today. So as we are looking at this next step of reopening and then potentially more reopening in the future, what would the metrics have to show you in order for you to either delay the next steps of reopening or to roll back what has already been reopened?
Again, Emily, I'd say hospital capacity. If I thought that we were at any risk there, that we'd take a second look. But as I look at the greater Northeast region, I see, as I said before, high positivity in some places that only have 50% capacity. I see high positivity in places that have, mandates. High positivity in places where you still have to, everybody has to wear the mask. So I think there's some greater factors here at work going on. So I would do anything I could if I thought it was going to make a difference. Right now, I think we're on a good track, and I think we're going to keep our hospital capacity.
And so just to clarify there, you're saying that you wouldn't roll back or slow down reopening unless the hospitals didn't have much capacity left, but that would be almost like a doubling, maybe even a tripling of what the hospitalizations are right now. So you're saying that you wouldn't consider delaying or rolling back unless hospitalizations doubled or tripled?
Well, I wouldn't be absolute about this. If we saw a sudden shift, we saw a variant, we saw Pfizer was not working against the Brazilian variant, which was on fire down in New York, you're right, we would get ahead of that curve. But I don't see any of that right now, and I do see incredible progress on our vaccinations, so I think we're ahead of those risks.
And one last question. I know that Hugh asked about state offices reopening, but just kind of in general, when we're talking about reopening, what's next up? What's next on the list?
Next on the list in terms of more broad reopening, look, we're sitting down with the legislative leaders. We're going over the list of all of our executive orders. I think it's time for them to weigh in. They may have a point of view on, anything else that ought to open. Right now, our bars are still closed, for example. Should we think about doing something outside at some point in the future? I'm pretty strict about masks. I'd like to think we're going to keep that in place a little bit longer. But those are all areas where the legislature may want to have a point of view.
So the next step of reopening is TBD at this point?
I think that's right.
Thank you. I appreciate it.
Connecticut Public Media.
Good afternoon. With this next stage of the vaccine rollout, wondering if there are any regional differences, some border town differences, areas of the state where we've seen more people register or more people not be able to get vaccines. What has the feedback been?
Well, I'll start. When I look at the positivity, as I said before, I can still see a little higher along that Metro North corridor, not dissimilar to what we saw a year ago. So I think that's where you have the highest positivity, and that's where we're still doing a lot of testing. Vaccinations are pretty universal around the state. Is that right, Josh?
Yeah, we've built out, I think, very robust coverage across the state at this point, across, our hospital partners, our federally qualified health centers. We now have hundreds of retail pharmacy locations that are online doing vaccinations. So we have very good coverage for vaccines. I haven't heard any stories about specific parts of the state being underserved at this point, but it's something we watch very carefully.
And as you do watch these things, if you notice that, like Fairfield County, there's a lot of demand, but it started to dwindle in the northern parts of the state, would you allocate more vaccines to this area? That's something you have planned within the next few weeks to distribute the amount of vaccines a little bit differently?
It's certainly something we're constantly looking at, absolutely. And we'll also have some additional flexibility built in now with all of the mobile capacity we have, both with the FEMA mobile unit as well as the 35 additional mobile vans in the partnership with Griffin Hospital. So those are also resources that can be deployed, where there's pockets of that need more vaccine delivered quickly.
Thank you.
The Waterbury Republican American.
Thanks very much. Thanks, Max. Sorry about that. Maybe Governor or Josh could answer this. When do you guys anticipate that state officials be in a position to gauge the ramifications of this J&J mishap on the vaccination schedule?
Josh?
Well, Commissioner Gifford and I were on a call with some White House officials earlier today. Not a lot of details that they had to share just yet. It sounds like they're sorting through it a little bit right now as well. But they did give us a lot of confidence, as the governor shared earlier, that the very significant increase in Johnson & Johnson vaccine that we had expected for next week is still on track. So that's great news. Beyond that, we're going to need to wait for a little bit more guidance from them. They made it sound like we should still see significant volume of Johnson & Johnson in the rest of April as well.
Okay, and how much how much are we expecting next week?
We don't have a complete total yet. The allocation through the HRSA to the federal FQHC program typically comes in on Friday, so we don't have complete visibility to that yet. We do know for the state allocation, we're going up from 120,000 doses to 142,000 doses next week, so that's a great start. We don't have final numbers on the federal pharmacy program yet either, but we expect that also to increase. So, it looks like next week should be another record week in terms of the number of first doses coming into Connecticut, which is great news.
And the governor mentioned earlier this morning something about maybe an increase in Pfizer doses next week. Anything on that?
Don't believe we're not anticipating an increase in Pfizer doses next week.
Okay. Governor, you mentioned earlier that you thought that private businesses would take care of this issue of verifying testing and vaccination status. Would you entertain any kind of state prohibition, basically blocking businesses from asking customers about their when the last time they tested or test results or vaccination status?
Yeah, I don't know, Paul. I mean, my inclination right now is that perhaps government should stay out of it. But that said, I'll sit down with the legislature. I mean, if you're a restaurateur, perhaps they'd like to make sure that all of their staff is vaccinated so the customers feel more comfortable coming in. And if you don't feel comfortable getting vaccinated, maybe you wear the mask a little longer or only be outside. So I think I'm going to let this get led by the private and not-for-profit sector for now and wait for guidance from the federal government.
And are we still the sort of operational estimate for the 16 to 44-year-olds? It's still 600,000. Has that changed at all since I think we last heard that estimate?
No, the projections for where we ended up today as we shift phases would.
Or ask you guys just to comment on it. The Department of Education issued a report yesterday that said, I believe, March or the last week was the highest percentage of in-person learning in Connecticut, I guess, since a year ago, March. And just wondered if you had any thoughts on that development.
I think it's great news. Our schools have been open since September. I know what an extraordinary difference that made. Our teachers have all been vaccinated. All our educators at least had the opportunity for that first vaccination shot. And Paul, the only thing I'm trying to get folks to do is we still have a number of students who are reluctant to go back into the classrooms. So we have students calling their friends saying it's safe to come back. We have teachers calling their students saying, come on back, we miss you. And I like to think sometime over the next month or so, our schools will just be humming.
All right, I guess I said that was the last question, but I'll tee one up for you. There's a basketball game, I think, coming up pretty soon that might be of interest to Connecticut. Your thoughts?
Look, I'm 100% all in. I'm a homer. Paul, why don't you take this one?
Oh, wow. Thanks, Governor. Well, as we all know, the UConn women's basketball team is made to the Final Four. And as everyone else know, the governor is the president of the Board of Trustees. And it is in statute that he will be rooting for the UConn women Huskies to not only win this next game against Arizona, but to win the whole thing. And so we will be rooting for the Huskies. We all bleed blue here in the capital in the state of Connecticut. Is that good enough, Governor?
Not bad. Not bad.
Thank you.
Thanks a lot, guys. Take it easy.
The Day of New London.
Hello, Governor. Let me ask whether there is still any concern about lingering hesitancy regarding the vaccinations, and have the 75 and older and the 65 and older groups, have they pretty much maxed out? Are you still directing messaging towards them, or are there other groups that you're concerned about and need to focus the messaging on at this point?
A little early to say, Brian, but I can tell you 81% of the folks 65 and above, it's slowed down, no question, but 81% is pretty good. You maybe remember when we brought the vaccines to the nurses at the nursing homes and the hospitals, the first pass was maybe only 33%. Then the next pass, we got up to 66%. So I like to think that as you have a friend who got vaccinated and they tell you how liberating it is and how they didn't have any side effects and how they feel a little more confident going about their day, that number will get up over 90%. That's my hope.
Okay, thank you.
The Connecticut Mirror.
Hi. You guys have noted that hospitalizations among older folks have been trending down. Do you have any data as to whether or not that has held in areas like New Haven, where the B117 variant has been found to be prevalent?
You want that, Josh?
Yeah. Actually, I think the Yale New Haven Hospital System shared data earlier in the week that showed their more recent hospital admissions broken down by age. And what you could see very clearly in their data were significant, frankly, dramatic declines in hospitalizations of people of older ages. And so the percentage and similar levels of hospitalization in people of younger ages, in some age categories, actually a slight uptick, consistent with the level of infection we're seeing, cases we're seeing among younger people. So it's a very important reminder to younger people that you can still get very sick from COVID, and you need to take it seriously, and you need to wear masks when you're around other people. But fortunately, those trends with regards to older people, where we have these very high vaccination rates and we have increasing evidence that these vaccines are incredibly effective, not just at preventing severe illness, but completely preventing infection to begin with, is holding firm there.
Well, so earlier in the pandemic, the pattern was hospitalizations lagged increasing cases and deaths lagged hospitalizations. So what's the current thinking about, the governor noted earlier, Connecticut is still very low in per capita deaths, but given that hospitalizations are not, they're better, but they're not as low as they were in the summer, and cases are higher. What is the current thinking about what to expect regarding, again, this cascade of cases to hospitalizations and ultimately to deaths?
Well, the time lag that we typically have experienced over the last year and the relationship between those metrics that you're describing, Paz, we would have seen that by now starting to pick back up in the form of more hospitalizations and more deaths of people of older ages, and we're not. And I think every public health expert that we've been speaking to says that that's what you would expect, right? If the vaccines work as well as advertised, that's exactly what you would expect to see, and we're seeing it. So that's the great news that we've been hoping for. You can see it in the nursing home data. We've had a grand total of 5 nursing home deaths in the last month, 5 in an entire month. So, there's evidence all around us right now of how effective these vaccines are at breaking that relationship that you described.
And when we look at the history of people who have tested positive, does the state have an estimate of what's the amount of natural immunity out there? And then when you put it together with the vaccinated population, do you have now any kind of a sense of what does immunity in Connecticut look like at this point?
So there is not great data on how many people in Connecticut or anywhere else have had COVID infections to this point. As everyone knows, a year ago when COVID was at its worst, there's very little testing available. So the best people can do is make estimates about how many people have had prior infection. And I've seen estimates that vary a lot. So I think the most important thing is that we're focused on getting everybody vaccinated. And once we do that, we have a high degree of confidence that we'll be able to get COVID behind us.
Thank you all.
All right, I'm getting my signal here. Let me just say something. A year ago was April Fool's Day as well. And a year ago, we were fools when it came to COVID. And there was hydroxychloroquine and just Lysol and masks don't work. But I want to leave on a positive note. 240 days later, Pfizer came out with a vaccine, mRNA, and then J&J and Moderna that work and are extraordinarily flexible and work against the most complicated variants. And here we are 1 year since April Fool's Day a year ago, and we've got about 40% of our population vaccinated with something that really works. And I think it's a testament to maybe it takes us a while to get going. When we get going, our biopharma system, our scientists are amazing what they've been able to do. But it only works if you get vaccinated. That's what the message was here today. We're making extraordinary progress, and we're going to win, and the UConn women are going to win. Thanks, everybody.